I ngā mana, I ngā reo, I ngā karanga maha autua, tēnā koutou, tēnā koutou, tēnā rā tātou katoa. Ki ngā mana whenua, ko Te Atiawa, ko Ngāti Toa, tēnā koutou. Ki tēnei whare, ko Te Papa Tongarewa, tēnā koe. Rau rangatira mā, tēnā koutou. Noku tuhonere ki a haere mai ki te whakanuia tēnei hui ngā whakahirehira. Ko te tūmanako ki a angatu tēnei hui. Nō reira, tēnā koutou, huri noa I te whare, tēnā rā tātou katoa. Thank you, Beverly, for your kind welcome, frighteningly accurate. And it is my very real pleasure to have the opportunity to speak with you all for a second time at your annual forum. Firstly, I would like to congratulate you, Beverly, and now I can't see where you've gone. There you are. On becoming the Council's chair. Your long-standing commitment and leadership in health, particularly in Maori health, is greatly valued. I want to thank you for generously sharing your vast knowledge and experience for our collective benefit. I also want to thank the NGO Council more broadly for organising this forum and co-hosting with the Ministry of Health. These gatherings are a fantastic opportunity for collaboration because we know that if we want to achieve solutions, we all have to work together to do that. And over the past year, of course, I've met, recognised quite a few faces in this room at various events and across New Zealand. And some of you I've met, of course, alongside our inspiring Prime Minister at public launches or other events. And also, I want to acknowledge meeting with a group of council representatives with my Associate Minister of Health, Julianne Genter, at my office in the Beehive in the past year. As I said at last year's forum, I welcome and value your views about our health and disability system. You all work at the heart of our communities and play a special role in the health and well-being of New Zealanders. That close connection puts you in a unique position to truly understand the needs of our people. And I want to say from the outset a big thank you for the service that you provide every day, day in, day out, in your different parts of the country. The theme for today's forum is opening the doors in Wellington. And just yesterday I got to literally open some doors in Wellington and to thank people who volunteer across the health and disability sector at the annual Volunteer Awards held in the Grand Hall in Parliament. It's one of my favourite events because it's a chance to recognise the major contribution played by volunteers, the major role played by volunteers in working across our system. Many of this year's recipients, as is the case in past years, were people working in the NGO sector alongside you, and you will know some of those recipients, I'm sure, yourselves. I want to talk a little about the wellbeing budget. At the end of last month, the government presented New Zealand's first wellbeing budget. Indeed, it's the first of its kind in the world. It's been very closely followed by the OECD and other overseas actors. I want to have the opportunity today to update you a little on some of the initiatives that will affect the health and disability sector. It is an ambitious task, doing a wellbeing budget. It is something that is, being watched by the world, as I say, and we're attempting to put a focus on people and planet rather than just the traditional cost-benefit analysis. It's actually the most thorough budget process that's ever been done in New Zealand because the traditional cost-benefit analyses were done first, but then on top of that, we've looked at human capital, social capital, physical and financial capital, the traditional one, and also the effect on the environment. And looking to those long-term impacts is a different thing to do for budgets, surprisingly. We all know that GDP isn't a perfect measure. It never has been. If I were to smash that window over there, that would contribute to GDP because insurance would pay out and more money would come into the economy. If I were to stay at home to look after a sick child, that would not contribute to GDP. And I think all of us in this room could probably agree which of those was actually more beneficial to the long-term well-being of our country. Now, I know your network's 520 plus membership and about 115 affiliates rely to varying degrees on government funding. And your work spans a range of sectors, and many of the initiatives in our budget do that too. It is my real pleasure that we've done things a bit differently, because NGOs across New Zealand have been stretched for a long time. One budget won't fix that, but it does feel like some of the initiatives, particularly in the mental health and wellbeing space, will make a real difference in fields where people already know how to make every dollar stretch the extra mile. So, because we can't measure in dollar and cents alone, as I've said, we've focused this budget on 5 priorities: taking mental health seriously, improving child wellbeing, supporting Maori and Pacific people's aspirations, building a productive nation, and transforming the economy. I'll say a little more first about our government's focus on taking mental health seriously. When I talked at last year's forum, I said that one of my top priorities was improving our country's mental health and addiction services. And indeed, that's why I launched the inquiry into mental health and addiction in our government's first 100 days. All of the parties that currently make up the coalition government had campaigned on having an inquiry. We all knew that it was time to have a stock take and then to invest for change. I'd particularly like to, just at this point, acknowledge Dr. Barbara Disley's contribution as one of the members of the inquiry panel. And Barbara, it was nice to meet you, or to have you welcome me on the way in today. Thank you for your work on that panel, and thank you to all of the panel members. They've made a huge contribution. Overwhelmingly, what the panel heard around the country is that the current system is not working for everybody. Services are under pressure, and we need to take a more holistic approach to wellbeing. The inquiry's report, Heara Oranga, charts a new direction for mental health and addiction. It's an approach that puts people at the centre. And the day before Budget Day, the Prime Minister and I announced the Coalition's government's response to that report. We had agreed in principle, or will undertake further work on 38 of the inquiry's 40 recommendations. The Wellbeing Budget, announced the next day, delivers on many of the inquiry's recommendations. There will be a need for further investment, but we have made a good start. The budget invests $1.9 billion in mental health and wellbeing over 5 years. The significant and sustained investment includes aspects relating to education, health, corrections, justice, and housing. One of the centrepieces was a $455 million investment in expanding access and choice in primary mental health and addiction support. Investment in mental health and addiction primary care responses will promote prevention and early intervention so that more people stay well, reducing demands on expensive acute services. And most importantly, making sure people in their communities are looked after. As I'm sure you'll know, most existing mental health and addiction services are delivered through DHBs, either directly or via contracts with NGOs or community providers. As a part of a major funding boost for district health boards, a total of $213 million will go into mental health and addiction services through the ring fence. We also need to upgrade facilities and add capacity by building new facilities. And that's why we ring-fenced in the budget over $200 million specifically for mental health and addiction facilities, of a total $1.7 billion that we are investing for DHB capital projects. And to put that in perspective, that $1.7 billion we've announced in this budget for capital projects is more than the capital set aside for the health sector across the entire period of the last government. And so in one of our budgets, we've put in more than was put in for the entire period of the last government. we are serious about building our public health facilities. Earlier this month, I had the pleasure of announcing the first of these projects from the new funding, and it's an inpatient mental health and addiction unit for Hauora Tairāwhiti's Gisborne Hospital. That 1.7 billion that we're investing this year in health sector capital projects builds on 750 million last year, already bigger than any investment made under the previous government. So those projects will require workforce, we'll be scaling up, but what we've done this budget is signal some funding for next year as well as a part of that, so that we can encourage those who would build facilities to develop the workforces that are needed. I want to turn to our government's focus on Maori and Pacifica aspirations. I did speak to you at last year's forum about improving equity here in Aotearoa, an aspiration which underpins all of my priorities for the health and disability system. I know everyone in this room will have their own accounts of where we've fallen short in terms of delivering equity of outcomes for Māori and Pacifica. And I think we need to be clear that as a system, we need to make significant changes in how we deliver and design services if we are to make real difference to achieve fair outcomes for Māori and Pacific peoples. And as I've already said, achieving aspiration for Māori and Pacific communities was a major focus of our wellbeing budget. We know that the majority of Māori and Pacific people continue to access mainstream services, but there's an increasingly important role for kaupapa Māori services. So, for example, of the 455 million set aside for that primary mental health and addiction response I just spoke about, 62 million is specifically ring-fenced for kaupapa Māori delivery. We're also investing in a variety of other ways because we need to invest across the system. 10 million over 4 years for our Māori workforce development package, which will incentivise and support hundreds more Māori students into health professions, and there are successful models around the country that we know we can build on. We've increased the Te Ao Awa Hatanga Hauora Māori Health Innovation Fund by 4 million over 4 years to support Māori health providers to develop and provide Māori-led health initiatives that improve equity. An extra 10 million over 4 years will be invested in the Pacific Provider Workforce Development Fund to help develop a strong and sustainable Pacific health workforce and leadership that can contribute to improving equity for Pacific peoples. We're investing 4.3 million over 4 years for a wraparound support service for Pacific nursing and midwifery students to improve our graduation rates there. And also, we're investing almost 10 million over 4 years in the Pacific Innovation Fund, which aims to better resource, drive and assess innovative community health projects that improve Pacific people's health and well-being. There's a rheumatic fever program, 12 million over 4 years to reduce the incidence amongst Māori and Pacific peoples and to support better management of the illness in the wider Auckland region. And there are a wide range of initiatives to support Māori and Pacific aspiration that fall outside vote health, such as an 80 million boost for whānau ora, additional funding for a kaupapa Māori approach to tackle reoffending, and more support for te reo Māori and Pacific languages. A word on cost pressures in the sector. We all know that the sector as a whole faces significant cost pressures, and in the budget we've invested to address this. Disability Services receives an additional 288 million over 4 years to maintain services, to meet rising costs from growing demand for services and wage increases and in-between travel costs. DHBs are getting their largest increase in operating funding in a decade at $2.8 billion to help them meet additional costs in delivering health services because of our growing and ageing population. And we've also increased funding for home and community support workers to cover wage increases plus time travel and associated costs involved with completing their roles. Emergency ambulance services, 21 million, funding boost to improve financial sustainability on top of an extra 17 million over 4 years for the agreed funding path that was agreed 2 years ago. We need to make sure we're resourcing all of these important aspects of our health system. And building workforces is critical too. We're investing 30 million in rural GP training places. We're putting additional money, I think I may have misspoken there, 18 million over 4 years for GP training placements in rural and regional areas, plus locum relief for midwives working in rural settings. And LMCs get the 30 million, lead maternity carers, an investment to increase the fees that they are paid as midwives working in our communities. When I met with the NGO Council a year ago, we discussed the Health and Disability System Review and the importance of including the unique perspective of non-government organisations. I completely agree with the need to do that, and I'm pleased to hear that the panel has met with the NGO Council to seek your input. I want to acknowledge panel member Dr. Lloyd McCann, who's speaking here today. Thank you to him for his work on that project. That project, as I probably indicated last year, is central to our future aspiration for the health and disability sector, because it has the twin responsibilities of finding out how we can make sure we are funding our health services sustainably into the future and how we can deliver better equity of outcomes. And as I think I said last year, the opportunity for that review is the reason I put my hand up for the role of Minister of Health. You won't be surprised to learn I did not have to use my elbows to get the role. There was not a big queue. It's not deemed to be a role which has career-enhancing aspects to it. But I do see that review as a truly great opportunity, and so I am grateful for the contribution the NGO Council has made to that, and grateful for those who are working on that project, because our health system compares very well internationally in terms of the quality of care we provide for people. We do it efficiently, but there's not one person I've met working in the sector who says there aren't things we could be doing better. That review will chart a course for a fairer and more sustainable health and disability system that is well placed to respond to the future needs of New Zealanders. And for those of you who are following the progress, they will give me an interim report in August, and in March next year the final report comes out, which will allow parties going into the next election to form their own view on it, so that whoever makes up the next government will be informed by a thorough evidence-based review of our health sector. In closing, I want to thank you all again for your massive contribution on a daily basis to the well-being of New Zealanders. You are vital to the success of our health and disability system. So I congratulate you on holding this forum and on jointly seeking solutions to New Zealand's long-term challenges. It has been a pleasure for me to have the opportunity to address you again at your conference this year. I wish you all the best for your deliberations, and I look forward to hearing the outcomes from your meeting. Nō reira, tēnā koutou, tēnā koutou, tēnā rā, tātou katoa, kia ora koutou.